Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wiseye.org.
Needs a test should be tested. And through the Badger Bounce Back Plan, we're taking a comprehensive approach to making sure that's the case. A total of 15 specimen collection teams from the Wisconsin National Guard, comprised of more than 500 citizen soldiers and airmen in total, are now operational across Wisconsin, supporting local health departments and the Wisconsin Department of Health Services' effort to increase the state's COVID-19 testing capacity. The Wisconsin National Guard is assisting with testing everywhere from correctional facilities and health clinics to private businesses and community-based testing sites. Earlier this week, we announced a number of testing sites in communities throughout northwest Wisconsin, and we have since added testing sites in northeast Wisconsin and central Wisconsin. And early next week, we will be opening community testing sites in Madison and Milwaukee. Anyone who goes to one of these community testing sites will receive their test for free. If you need a test, we want you to get a test. As we continue to expand our testing utilization, I will continue to urge the federal government to do its part to prioritize our requests for materials in support of Wisconsin's public health and safety needs. Right now, the state is in pretty good shape on testing supplies, and we appreciate the support we've received from the federal government so far. But Wisconsin still needs help from the president to get additional testing supplies like swabs and reagent so that we can ensure everyone who needs a test can get one. The more we test, the more we expect to see coronavirus cases rise across Wisconsin. But there is hope for those suffering from the virus. Many hospitals are treating patients with convalescent plasma. Convalescent plasma is plasma donated by a person who has recovered from the virus. It's currently given to high-risk hospitalized patients or those in life-threatening stages of the disease. The plasma treatment is approved by the FDA as an investigational new drug. It could offer hope to the hundreds of patients who continue to be diagnosed. In the past, convalescent plasma has been used to treat H1N1 influenza, Ebola, and SARS coronavirus, and other pathogens. Versity Blood Center of Wisconsin has been providing blood products to Wisconsin hospitals for more than 70 years. They were among the first in the country to begin collecting plasma from recovered COVID-19 patients to provide that to hospitals in our state. Many hospitals are using the plasma treatment, and the studies are ongoing to better understand its effectiveness. However, the demand for plasma is now far exceeding the number of donations. I strongly encourage recovered patients to donate plasma to help others. You fully understand the help and treatment you receive to bring you back to health. This is your opportunity to help others, to provide a sense of hope, and perhaps a life-saving gift to someone now fighting their own battle. Recovered patients can call 1-866-702-HOPE, H-O-P-E. That's 886-702-4673, or they can visit versity.org/COVID-19 plasma. We're all in this fight together, folks, and as we continue to wage an all-out war on the virus, we're also planning for the future. Earlier today, we released a series of publications to keep businesses informed of best practices and safety tips to keep workers, customers, and families safe while turning the dial towards reopening. These brochures include general guidelines for all businesses to follow, as well as industry-specific advice, such as for restaurants, retailers, manufacturers, professional offices, farmers, builders, hotel and motel operators, barbers, personal care services, and other fields. Wisconsin businesses have done a great job in adapting to our state's safer-at-home order, and that's what's been part of the huge success in flattening the curve. As we continue to turn the dial, businesses need to know how to re-engage safely so that employees and customers can feel confident when they return. The guides were developed by the Wisconsin Economic Development Corporation in consultation with the Departments of Health Services, Agriculture, Trade, and Consumer Protection, and Tourism, as well as our industry experts and associations. This is actionable advice for businesses, especially small businesses, as they begin the road back to reopening. Instead of trying to go it alone to figure out the best answers to basic questions such as how to handle transactions at cash registers, what to do about merchandise that's been handled by customers, and how to set up an office using social distancing strategies, these businesses can consult advice from industry experts and health professionals to make good decisions. Some of the general advice for all businesses include making sure that employees who are sick don't come to work, curtailing business travel whenever possible, promoting telecommuting or other work-from-home arrangements, making sure employees have access to sanitizers and personal protective equipment when appropriate. The reopening of businesses around the state will continue to be guided by healthcare metrics contained in the Badger Bounce Back Plan, which include tracking new cases of COVID-19, assessing available medical resources to cope with COVID cases, and ensuring adequate testing and mitigation resources. No one is ready to move forward by getting back to our Wisconsin way of life more than I am. Because of all the sacrifices folks have made as we stay safer at home, I know we're on our way. So let's stay the course, Wisconsin. And now, before Secretary-designee Andrea Palm gives her daily update, I'd like to let you all hear directly from Arielle Tenor, an RN on the front lines of this crisis in Brown County.
Thank you, Governor Evers. My name is Arielle, and I am a nurse in Brown County. I work in a med-surg unit that, due to the novel coronavirus pandemic, has now been deemed our, quote, backup COVID unit. This means that when our primary COVID unit is full, or when it underwent construction to accommodate for the growing need, those COVID positive patients or any patients under investigation would be transferred to us. I know previous nurses have talked about the physical effects of this pandemic, so I want to now speak to the emotional ramifications of the present. There is an enormous sense of fear involved for the patient. They wonder, what does this mean for me and my family? Is there even a treatment for this? Where or when would I have been exposed? Is my illness going to get worse? If so, how bad will it get? Will I have to be on a ventilator? Can I even survive this awful disease? I know these are questions that patients ask because I have heard them all multiple times over the preceding weeks. Not only does this take a toll on the patients themselves, but it takes a toll on the nurses who are faced with such inquiries. Unfortunately, there is just so much unknown in our current state. And I'm sorry, but I honestly don't know is one of the most difficult things to tell a patient. I know for many nurses, even after we've handed off our patient assignment and clocked out, our brains don't just shut off as soon as we leave work. On our drive home or while lying in bed trying to fall asleep, your mind reflects back on the last 13 to 14 hours. You wonder, could I have done anything better or different for my patients? Did I forget anything pertinent? How will they do over the next 12 hours? Currently, a nurse not only goes home and reflects over these questions, but we now obsess over, was there any time that potentially could have been a breach in PPE or protocol while I was caring for a patient in a COVID room? Could I have committed this breach? Could I have exposed myself to COVID-19? Could I have brought the virus into my home? Can just one accidental breach be enough to infect myself and my loved ones? What can or should I do differently on my next shift? I think we as nurses worry so much about questions such as these because it's not only ourselves that we are trying to protect, but also the families that we come home to, as well as the patients for whom we will be caring on our upcoming shifts. Nurses are trying so hard to make sure that we uphold all of the appropriate precautions in the hospital setting. But unfortunately, this picture is very incomplete if those precautions are only being honored in the hospital. They need to continue beyond the hospital walls. I'm not saying everyone needs to wear PPE, but there are ways to keep our community safe. I completely understand how stressful and awful this social isolating has been. Please believe me that I know. I do, because when I'm not at the hospital, I too am home self-isolating, and it's not easy. It's been physically and mentally draining. But what I do know is exponentially worse right now is being isolated to a hospital room by yourself, or being diagnosed with a potentially life-threatening respiratory illness that can take a life at any age and for which we don't yet have definitive treatment. I can't help but think to myself, at least when I'm self-isolating, I get to be in my own home. For this reason, I feel very strongly about trying to reach out to the young and healthy populations, because it is true that these individuals may not be immensely impacted in a physical way by COVID-19 if they were to come into contact. But unfortunately, I have also seen the complete opposite. I have seen patients ventilated who are younger than me, and it is an awful, horrifying experience. I don't want to see more patients test positive, and I don't want to worry so much about my family, my friends, neighbors, myself, and my community. This is why we all need to work together. For me, that means PPE every shift. And for all of us, it means physical distancing and self-isolating. I know it's hard, and I wish it didn't have to be this way. But I've seen what this virus can do, and we need to do everything we can to keep each other safe, sane, and healthy. Thank you, and I'll send it back to Secretary-designee Palm.
Thanks, Arielle. Good afternoon, everyone, and thank you for joining us again today. I'm going to start with our numbers today. We have 97,265 negative tests, which is an increase of 4,230. There are now 9,590 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 375 cases over yesterday. Our total deaths here in Wisconsin have reached 384. We are tracking 235 facility-wide investigations across the state of Wisconsin. I start with these numbers because they tell an important story. The numbers tell us that practicing physical distancing and staying safer at home is making a difference. It is slowing the spread, saving lives, and protecting our frontline healthcare workers. But the numbers also tell us that COVID-19 is still in our communities, and there is more work to be done. As you continue the work of staying safer at home, at DHS, we are working to build the public health infrastructure necessary to actively manage this virus as we continue to turn the dial. We are hiring contact tracers. In fact, we've already sent interview invitations to 415 candidates, and we are still accepting applications. Contact tracers do the fundamental work of following up with every individual who tests positive. If you test positive, a contact tracer will call you. Please answer the phone. They will ask you questions about your symptoms, where you visited, and your recent activities. And when they follow up with those you've been in close contact with, they are not allowed to share your name or information. Contact tracing ensures that Wisconsinites who may have been exposed are informed so they can protect themselves and their loved ones by self-isolating and help us stop the spread. By answering the phone and answering these questions, you are helping your friends and neighbors stay safe. We are also doing critical work to protect our frontline healthcare workers like Arielle by extending the life of our PPE, thanks to the new Battelle decontamination system and UVA decontamination sites we have across the state. I hope you will all help us spread the word across Wisconsin. Healthcare workers need to save their N95 respirators so they can be decontaminated and safely reused. And we are increasing our testing capacity. In fact, we now have 51 active labs here in Wisconsin with a daily lab capacity of just under 14,000 COVID-19 tests. But this work can't be done alone, and testing capacity doesn't mean much if we're not running the tests. Thanks to our partnership with the Wisconsin National Guard, we are standing up more and more community testing sites across the state, and you can now find them on our DHS website at dhs.wisconsin.gov/testing. Please check back regularly, as we'll be updating the website with new locations as they become available. So, if you're experiencing any symptoms of COVID-19 or have been exposed to someone with COVID, please get tested. Just as a reminder, the symptoms include a fever of over 100.4 degrees, cough, shortness of breath or difficulty breathing, a sore throat, headache, chills, muscle aches, and a new or recent loss of taste or smell. Even if you have mild symptoms, please get a test. Wisconsin, together we are doing the work, but we're not yet done. Our mission at DHS is to protect and promote the health of all Wisconsinites, and we cannot do it without you. We have incredible partners in this effort, our healthcare workers, the Wisconsin National Guard, and you. Please continue to stay safer at home. Limit your essential trips. Practice physical distancing. And if you have symptoms or exposure, get tested. Thank you, Wisconsin, for all the work you have done and continue to do to keep each other safe.
Thank you, and we'll now open it up for questions. A reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question, and in the interest of time, only one question per reporter per media outlet. And we'll begin today with Shemaine Mills from Wisconsin Public Radio. Shemaine?
Hi, thanks for taking my call. I noticed that there's a small spike in the percentage of people testing positive for COVID. Still a downward trajectory, but a little spike. I'm wondering what accounts for that. Thank you.
So this is Ryan Westergaard with the Division of Public Health. I think with all of the parameters that we follow daily on our website, variation from day to day is expected. The things that might account for the variation in the percent positivity rate could be the proportion of tests that are done as in response to some of the outbreaks. If we know that there's numerous cases in a facility and we deploy extra resources to test a larger number of people we know have been exposed, we might expect a higher percentage of the positive than if we're testing people with minimal symptoms in a general population setting. So I don't think that we can say definitively that this particular spike was due to any one of those things, but those are some of the reasons for variation in those numbers on a day-to-day basis.
Thank you, Shemaine. Now to Scott Bauer from the Associated Press. Scott?
Hi, thanks for doing this call once again. I was curious, after the April 7th election, you asked people who tested positive whether they had been at the polls. Why was that a good idea to ask about, but not ask if people had been at the April 24th rally at the Capitol where 1,500 people gathered? And it's my understanding we now have had 72 people who tested positive say they were at a large gathering after April 24th. So why was it a good idea to ask about the election but not ask about the rally?
So, Scott, I think the work of contact tracing gets at all of those things. It asks about where you've been, who you've been in contact with, the locations you visited outside of your home. And so whether you went to the polls as a poll worker or as a voter, whether you came to the protest or went to another large gathering, that would be part of the information we would get when those contact tracers were making those contacts with positive cases and subsequently the people that they may have exposed.
Thank you, Scott. Now to Emily Fannin from WKOW in Madison. Emily?
Hi, thanks for doing this call. Governor, I want to ask you about the reopen guidelines. While this is something that many businesses have been asking for, the Tavern League just told me that they still just want a date of when they could reopen. So I guess what would you say to them, saying that they are happy you have this in place, but they still just rather have a set date?
Yeah, and everybody would like certainty. Unfortunately, the virus doesn't work that way. My answer directly is this. As we move forward, we will continue to turn the dial instead of flip a switch. if we knew the exact date that we feel that we can feel comfortable having taverns open in the state of Wisconsin, we'd give them that date. But the fact of the matter is, we look at this data every single day. We will make judgments about which groups of businesses are less susceptible to having the virus being spread, and we'll make a decision based on that. So I know it'd be great to have a date, but I can't imagine it being any better by having set a date and then saying, oh, sorry about that, we can't do that. So I think it's difficult. I think tavern owners, I think restaurants should begin the process of thinking about how they are going to be prepared and what they need to be prepared to finally open. Excuse me.
Thank you, Emily. Now to Sarah Seifert from the Eau Claire Leader Telegram. Sarah? And a reminder, *6 to unmute your phone. Sarah Seifert from the Eau Claire Leader Telegram. Okay, we're going to move on then to Cammie Rapson from WBAY in Green Bay. Cammie?
Good afternoon. My question is regarding the Supreme Court decision. If it were to overturn Safer at Home, with the guidelines that you released today through the WEDC, how comfortable are you in using them to potentially reopen Wisconsin as soon as possible? Please detail the reasons behind your comfort level.
The guidelines are guidelines, and to me, they were created, as I mentioned, by not only people within the Wisconsin Economic Development Corporation, but also members of the business community, and frankly, customers all across the state. So I do believe they're good no matter what happens with the Supreme Court race. It's just good information to have, and so I'm glad to have WEDC being a partner with us on that. Excuse me. With us on that, and they're good. They're good to go regardless of the Supreme Court decision.
Thank you, Cammie. Now to Victor from CBS 58 in Milwaukee. Victor?
Thank you again for taking the call. My colleagues here at 58, Brittany Lewis and Mark Stevens, have been engaging with viewers specifically about payments from DWD and specifically about the $600 payments that some of them have been waiting for. I was wondering, can you answer definitively when people can expect to receive those payments by, and when they will be receiving one payment or back payments as well? And what is your office doing what is the governor's office doing to address the unemployment backlog, as this is obviously a big issue and a lot of concern for people out there?
Sure, and I understand that, and I'm disappointed that we're not hitting 100%, but that considering we had over 500,000 UI applications off the bat, and last year we had 287,000 for the entire year, there's a significant difference. So we've been adding staff, and we continue to add staff. We just contracted with a call receiving service so that we can more adequately do this. I'm as disappointed as anybody is as it relates to not getting that money out in the best way possible. We are batting well, though. The vast majority of the people are receiving those payments, but it is not correct, or it is not appropriate for someone not to be receiving it. So we're doing everything in our power. We're adding more staff. We're contracting with outsiders to help us receive those calls and get the money out in an appropriate way.
Thank you, Victor. Now to Jessica Van Egren from Up North News. Jessica? Jessica Van Egren from Up North News. And a reminder, *6 to unmute your phones. Okay, we'll move on then to Victoria Saha from WAOW-TV in Wausau. Victoria? WAOW-TV in Wausau. And a reminder to press *6 to unmute your phone.
Hi, yes. This question is for Governor Tony Evers. Why was this?
I'm not sure.
Why was the step taken to release 1,600 inmates? Are you confident that this will help stop the spread inside prisons?
I'm sorry, could you repeat the question? You kind of broke up there.
I think I actually get the question, Governor. So the 1,600 figure, I believe that's coming from the Legislative Reference Bureau. They issued a report this morning, and then quickly after issuing the report, they issued a clarification correction about how they came up with the 1,600 number. That wasn't 1,600 people being released from Wisconsin prisons. That was 1,600 people who were being detained in jails or other facilities for probation violations and other nonviolent offenses. And it's those individuals who, because they didn't have a violent offense or that they were able to be safely returned to the community in order to address overcrowding in local facilities. But again, it wasn't 1,600 people being released from the Wisconsin prison system.
Thank you, Victoria. Now to Steve Westergaard from the Platteville Journal. Steve?
Thanks for taking my call. So early, actually, I think it's been a pretty consistent thing in your administration. You've been talking about doing a statewide approach and not a regional approach. But from what I understand, Dane County has decided to continue being basically locked down up until mid-July, and I understand that Milwaukee County is either doing the same thing or considering doing the same thing. And I'm interested in your reaction to that. Are we to expect, for instance, that we could end up with a continued lockdown through mid-July at this rate, or is it okay from your perspective that counties go an opposite direction from the state?
Well, I'll answer the question quite directly. It is unclear to me what that actually means, whether Dane County or Milwaukee County or any other county continues with a healthcare emergency. To me, it does not necessarily mean that people won't be participating in, I'll use this example. Do I believe that the Dane County issuing that extension, does that mean they won't be able to use the golf courses? I don't believe that. So I think you have to deal with the county executives to answer that question. The importance of this, and I'll answer this once again because that was at the genesis of your question, is yes, I believe that there are opportunities for us to turn the dial on statewide issues. And I've given several examples over this last couple of weeks regarding that. Does that mean I'll never, ever consider something on a regional basis? No, it does not. But I owe it to the people of Wisconsin to make sure that we exhaust all opportunities that we have to dial for the entire state. That reduces confusion, and it also helps us all be part of the safer at home effort to successfully do something statewide.
Thank you, Steve. Now to Mary Jo Ola from TMJ4 in Milwaukee. Mary Jo?
Hi there. Thanks for your time. Just want to go back to the pending Supreme Court decision for the governor. Are you expecting the Supreme Court to announce their decision today? How are you feeling about it? And what, if anything, is your administration doing in preparation, no matter which way they rule?
Yeah, I feel great about it. If indeed the decision is based on facts, the law, and precedent, we win. If it's based on some other issues, we may not win. So we feel confident about our chances of winning. In turn, if it doesn't turn out that way, it's difficult to say how we're going to move forward because there's so many moving parts involved with this, and it depends on how it's actually decided. There's many different ways it can be decided, and so once we hear what the response is, we'll be able to respond appropriately how we move forward. And as far as the when, no clue. I have no clue. The Supreme Court knows. We can maybe you could pose that question to them.
Thank you, Mary Jo. Now to Jonathan Nizer from NBC 26 in Green Bay. Jonathan?
Yes, thank you. With the Badger bounce back gating criteria, I see earlier this week we had 2 green lights and one of them has turned red again. Could someone kind of clarify, should Safer at Home last all the way through the extension on May 26th if we still have some red lights or gray lights and not all green, what that means?
Yeah, so Badger bounce back is right. It's the plan. It is the plan forward, and those gating criteria are designed to tell us that we are moving in the right direction, that we have reduced the spread of the disease to a level in which we feel we are protecting the healthcare system. We are prepared to do what we need to do on a daily sort of hand-to-hand combat basis to do the testing and contact tracing necessary to keep small outbreaks small and reduce the spread of the disease as folks continue or start to more become more socially interactive as we turn the dial. And so we are tracking those green and red lights on a daily basis and want to make sure we're moving consistently in the right direction in those gating criteria.
Thank you, Jonathan. Now to Emerson Lehman from WSAW-TV in Wausau. Emerson?
Yes, thank you very much. I'm curious if the state does see the 14-day decline before May 26th. Is there a chance that the Safer at Home order could be lifted a few days early should we see that decline?
I'll try that one. First of all, as Secretary-designee Palm talked about, we're always looking for trends. And if Safer at Home is working, we want to make sure those trends continue. Now, whether we move it back or not is somewhat immaterial. And it is because we, on a daily basis, look at that data, and if it's moving in the right direction and we find ways which we can turn the dial, we'll turn the dial and make fewer restrictions on folks. We did that already, where we allowed all businesses the opportunity to do curbside business, picking up and dropping off, and I know many businesses across the state have done that. And we will continue to do that going forward until that order is no longer in place.
Thank you, Emerson. Now to Denise Lockwood from Racine County Eye. Denise?
Thanks for taking my call. Some have raised questions about how COVID-19 deaths are counted. Can you walk us through how that process works in determining if a person died because of COVID-19 or if they died because they had another underlying illness and tested positive for COVID-19?
Sure, it's Ryan Westergaard. I can address that. So in every setting where someone dies out of the hospital or in cases where patients die unexpectedly in a healthcare setting, those determinations are made by medical examiners in local jurisdiction, and they are trained to as healthcare professionals to make those determinations, and using the information from the chart and postmortem observations, they would be able to determine whether it was a primary cause or a contributing cause. So that's true of all causes of death and all infections. So often, increasingly, people with a compatible illness are being tested in healthcare settings. If they're not and the cause of death is unknown, medical examiners or coroners can perform postmortem testing. So they really try to use the totality of information that they're available to make that determination, and then it would be reported on the death certificate as either a primary cause or a contributing cause of death.
Thank you, Denise. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks for taking the call. The daily positive percentage was kind of dropping before today, going up 8% on Wednesday to 5.7 yesterday. Would there be a point where the daily percentage gets to a low enough percentage that we might be able to turn the dial a little bit faster than the expected plan right now?
So I think, Casey, the point of the gating criteria is to help us understand in totality if we're moving in the right direction. It measures a variety of things that are important to helping us know that we have made enough progress to safely move into phase 1 of Badger Bounce Back. And so that is why we've posted those. We are using the green and red signals so that folks understand when we've met those criteria. If we meet all 6 of them, obviously we want to move to phase 1 as soon as we can, but we need to track that data. We update it daily, and we will watch these trends until all the lights turn green.
Thank you, Casey. Now to Spectrum News 1, Magali. Magali, it's Spectrum News 1.
Hello.
Hello.
Thank you for taking my question. I just wanted to get a little more information on the plasma donations. Is it more available now as more donations are needed? And is the procedure to get that done, has it become easier now for recovered patients to do so?
So in community settings, plasma donation centers are available for this, and people should contact their local plasma donation center for details. But in general, people need to have had evidence, a confirmed case or positive test, I believe 30 days previously, be completely well, and then they can have discussions with the plasma donation center about donating plasma. And in hospital settings, it's still considered, experimental therapy. There aren't trials showing that it's, definitively beneficial. Although, as the governor mentioned, there's a track record. There's a history of using this kind of therapy in a range of infections. So there's promise to this, but it's not considered a first line standard of care at this point. It's in the category of things that can be tried under the right the appropriate circumstances, knowing that there's risks and benefits associated with unproven therapies. But it's something that there's a lot of promise about.
Thank you, Magali. Now to Ruth Conniff from Wisconsin Examiner. Ruth?
Hi, thanks for taking my question. I have a question for the governor. I wanted to know if legislative Republicans in your meeting with them on Monday mentioned they're planning to have press conferences in different cities around the state at pushing for a regional reopening plan, and also if you could comment on your willingness to pursue regional reopening in areas that have lower infection rates.
Yeah. Once again, the issue of regionalization is not a plan itself. That I just have to emphasize. But there are reasons to look at things statewide. Number one, the virus doesn't really know regions. It just goes where it goes. And so that is a difficult thing to make a guesstimate about where it's going to go next. Second of all, in our rural areas of the state that pretty much don't have the same kind of support, public health support that other areas do that have a larger population. So a surge in that area, that could cause a difficulty because of regionalizing or putting something in one county and not the other. Third of all, many of the businesses in rural areas depend on tourism to, or let's put it this way, rely on other people from that region coming to that region to partake in great Wisconsin. And anytime we increase the number of people that are congregating and together, especially when they might be coming from other regions, the virus isn't particularly attuned to infecting somebody locally versus somebody that's there and bringing something in. So there's several reasons why and statewide approaches is what we're looking at right now. That doesn't mean that we can't look at it in the future. But going forward, I know there are some dialing that we can do that will help business owners all across the state. And so that's where we're focusing on right now. But to focus all our efforts on regionalism, I think is important to talk about, but it's not a solution.
I think it also speaks directly to why we have established and why the governor rolled out earlier this week this very aggressive testing strategy. We've been working to build our capacity. We are now at about 14,000 tests a day, and are redoubling our efforts to make sure we're using every single one of those tests on a daily basis, because while you may not see a lot of positives in certain counties in certain parts of the state, those places also have testing rates that are very low. And so we don't know what we don't know, and increasing our testing rates in communities all across the state will really help us understand the prevalence of the disease. Is it really true that X county, Y county is not seeing cases? And that testing capacity and the subsequent contact tracing that comes with that is how we help those local communities, those rural parts of the state and counties all across the state do the day-to-day, hand-to-hand combat with this virus moving forward. And so really expanding our testing on a daily basis is part of how we get to a place where we know what the disease looks like in the state of Wisconsin and can make data-driven, informed decisions about moving forward.
Thank you, Ruth. Now to Jason Kelvey from Fox 6 in Milwaukee. Jason from Fox 6, go ahead.
Good afternoon, Mr. Governor. Thank you so much for taking my question today. With the best practices that are released today, what would happen if a business decided not to follow those best practices?
Well, I think they would have. They're guidelines. They are guidelines. They choose to use them, not to use them. We have thousands of businesses that, frankly, are already open and have been open since the beginning of this, and they have great guidelines in place already. So just like I am confident in the wisdom of the people of Wisconsin to be safer at home for this last several weeks, I am confident that businesses, as they open up, will use those guidelines to keep their workers and their customers safe. From the beginning, this has been not an economic issue versus a public health issue. We all know, and business owners know this well too, because I hear it directly from them. The bottom line is people have to feel comfortable and confident in their health and their safety, and that those people are also customers and consumers, and they're also workers. And so it is important that we get this right, and using those guidelines, they are guidelines for businesses to use. They may actually have better ideas than that.
Thank you, Jason. Now to Ben Meyer from WXPR Radio in Rhinelander. Ben?
Good afternoon. I noticed that the order yesterday, or I beg your pardon, the directive yesterday to get testing to African Americans and Latinos also included tribal members. As of course you know, many tribal members here in the northern part of the state, if they live on reservations especially, live in pretty remote areas. Do you foresee that being a challenge, getting the testing that's needed to tribal areas into reservations here in northern Wisconsin?
We've already done several tribal nations. I meet regularly with leaders of every week, actually, leaders of the tribal nations of Wisconsin, and I know there have been we have had testing in several of those areas, several of those tribal nations, and we'll continue to it. I looked at the list today. I know there's others that are on the list, but at the end of the day, we will continue to serve all the tribal members, all the tribes in the state of Wisconsin.
And they have the option to order testing supplies through the website, and those kits those supplies can be sent directly to the tribe to be used in their own tribal health clinics and then returned to our partners at Exact Sciences for them to run it through the lab and return the results. And so through the community testing sites that the governor just mentioned, as well as direct access to testing supplies through our partnership with Exact Sciences, we do want to make sure that remote communities, including tribal nations, have access to testing, and this partnership with Exact is one of the important ways that we're doing that.
Thank you, Ben. Now to Adam Rogan from the Journal-Times in Racine. Adam?
Hi, can you guys hear me?
Mm-hmm.
Yes.
First off, if somebody already answered this question, you guys can just say, watch the YouTube video. I apologize. I just got back from my phone calls. I missed the last few minutes. But I wanted to know if the Journal Sentinel story yesterday about how people, I believe it was people who are Latino, African Americans, or a part of a Native American tribe would all be able to get free COVID-19 testing. And I want to know how that would be implemented. I talked to a couple people in Racine County, and they said they weren't sure how that would be implemented, at least not yet. So I was hoping you guys could clarify that for me.
Well, the article, frankly, was about our concern as a state that people that live in difficult situations, have limited resources, and have traditionally had disproportionate negative health outcomes are having those same health outcomes in this situation. So it's our goal to make sure that people that come from disadvantaged communities and communities of color that are showing significantly bad outcomes are tested, and we're doing that through our community testing program that Secretary-designee Palm just talked about, and whether it's in Madison, Milwaukee, Racine, we'll continue to do that going forward.
I think one other point just to add on that is important. While we're definitely encouraging certain groups to be tested, it is community-based, so anybody within that community is able to be tested.
That's right.
For free.
For free.
Thank you, Adam. Now to Maddie Heim from USA Today Network, Wisconsin. Maddie?
Hi, thanks for taking this call. I actually have a weather-related question today. I'm just wondering whether you've been watching and paying attention to the research about warmer weather and humidity and transmission rates of the virus, and how you anticipate that summer weather will have an effect on transmission rates of the virus, if at all.
Yeah, I can address that. We've looked at those studies, and we're cautiously optimistic, but I don't think there's definitive reason to believe that the weather, climate itself, or warmer weather, will decrease the risk or an individual's susceptibility to the virus. I think the pieces that go into this are really that in this first wave of the epidemic, there were the dynamics of the epidemic behaved similarly in the northern hemisphere and the southern hemisphere. It's a brand new virus, so there's no sort of variability in people who have been exposed. Really think the entire population was susceptible. So in the normal seasonality with respiratory viruses might not come into play. And there's research from other respiratory viruses that the temperature can affect how long they survive and various things, but it's not clear that those will make enough of a difference given how highly transmissible the virus is, that if people are in close contact, the risk of transmitting the virus is pretty high regardless of those features. So it's fair to hope that summer weather would decrease the risk somewhat, but I don't think we can count on that, and I don't think we should plan for that, because there's a lot of reasons to suspect that the virus is so highly transmissible that it won't make a large difference.
Thank you, Maddie. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for taking my call. I understand that nursing home associations have raised some concern about the financial impact of COVID-19 on their operations, especially when it comes to increasing staffing costs and PPE. Are you planning any kind of action to provide additional money to facilities to meet their needs, and could any money come through the roughly $2 billion state has received from the federal government through the CARES Act? Thank you.
I did not hear the question.
So, Sean, we certainly are working through the CARES Act funding now, and the guidance we've gotten and the guidance we still need to get from the federal government about the distribution of those funds. I do think as part of the governor's original package, there was funding requested for a variety of healthcare stakeholders, including long-term care. But we certainly recognize long-term care, hospitals, other rural hospitals are all facing financial challenges because of COVID-19.
Thank you, Sean. Now to Riley Vetterkind from the Wisconsin State Journal. Riley?
Governor Evers, if the Supreme Court rules against the stay-at-home order, how quickly do you think that you and Republicans could agree on new rules? And what parts of your order are you willing to compromise on? Thanks.
Those are two questions. I'll answer the first. As I said before, it is going to take more than a minute to digest what the order is. If it supports our position, which I think we have a good position and we can be successful with, but if it isn't the case, if facts and the law and precedent don't sway the court and we lose, there are such a multiple of issues out there that they are deciding, including another case, frankly, so that it's impossible at this point in time to say, in 37 minutes we're going to have that and we'll have that figured out. It's going to take some time. It'll take at least a day to sort through that, and then after that we'll figure out what we have to do to work with the Republicans to continue to move our state forward.
Thank you, Riley. Now to Addie Bink from WFRB TV in Green Bay. Addie?
Hi, thanks for taking my call. I was just wondering, Governor Evers, as we get closer to May 26th, let's say the safer at home order stays in place and the Supreme Court doesn't overrule it, can Wisconsinites expect to see it end on May 26th and then the focus shifts to the Badger bounce back and turn the dial order? Or should we kind of maybe hold out and see if it gets extended on that date?
Well, the reason we set that date to give us an opportunity to do exactly what we're doing. We're massively increasing the testing, massively increasing the contact tracing, massively increasing our efforts to get the protective equipment we need to go forward. So we set that date with the full knowledge that we're going to do all these things, and as you can see, over the last several weeks, we're doing extraordinarily well in those areas, and so there's no reason to believe that the 26th isn't a reasonable date to end it. But we also know that the virus doesn't necessarily always agree with our analysis. But we set the date because we feel that it was a reasonable date, and to get to where we don't need to have safer at home. That's why we set it at that date.
Thank you, Addie. Now to Andy from WISN in Milwaukee. Andy?
Yes, real quick. I know there's guidelines in here for all kinds of businesses that you issue today. Are there any for casinos, or are you leaving those to the tribal nations?
Tribal nations are sovereign nations, and they have the ability to make their own decisions. Meet with them weekly, and I have complete belief that if they reopened and when they reopen, that they'll do it in a thoughtful, safe way. We've talked about this every week on those phone calls, and I know their concern is as strong about safety as our concern is about safety also. So I have confidence that they'll do the right thing, and I'm guessing that they will use a lot of the guidelines from other businesses that are out there, and there are American Indian casinos open across the country, so they can learn from their colleagues.
Thank you, Andy. Now to Angela Mosher from Milwaukee Public Radio. Angela?
Hello.
Good afternoon. It's Angelina. I have a question about, I know you've been asked about this, Governor Evers and also Secretary Palm, but I would just like to press a little bit more for detail on if the Supreme Court overturns the stay-at-home order. Like what will that look like? I understand it may take up to a day to digest what that will mean, but what would be the next steps moving forward? Would it be negotiations with the legislature? Would it be public hearing? What would that look like? Thank you.
I think I'll maybe take a crack at it. So this is Ryan Nilsestuen. As the governor said, part of the challenge is knowing how the Supreme Court's going to rule. If, as the governor said, if the court makes their decision based on the facts, the law, decisions that have been in place for over 100 years in this country and similar decisions from courts around the country, that we should win. And we'll continue using Badger Bounce Back in order to make decisions on how to move forward. That said, if they, we hope that they avoid legislating from the bench. This issue is too important and impacts the safety and lives of regular people all across the state. And so if they do, go down that path, it's tough to know exactly which direction they're going to go, and that's going to shape what options that are available. And in terms of working with Republicans, I think part of it, what the challenge of that and what you're seeing is we still haven't seen a plan from them. The public health emergency has been in place for weeks upon weeks upon weeks. They have said when they filed their initial lawsuit, they said they were working on legislation. They still haven't unveiled it. It's been several weeks since that has happened. So part of the challenge in terms of being able to negotiate somebody is you have to know what their position is. And, it's somebody recently told me, it's similar to if you're talking to your reporter and you hand them a story and your reporter just says, nope, don't like it. Well, you usually expect them to be able to point out what they don't like, what they need to be improved. And that's part of the challenge in terms of negotiating here. So I think, we'll see how the court rules. We'll see whether or not this can go through rulemaking or we have to go through some other approach. But part of the other side of this coin is the legislature simply hasn't met in session. They've met once and passed a very limited bill. They haven't held any hearings. I think they've held one hearing to date on COVID-19. So part of the challenge is we need the other side to be able to step up and put forward their own plan if we're going to be able to negotiate.
Thank you, Angelina. Now to Stephanie Hoff from WisPolitics. Stephanie?
Hi, and good afternoon. My question is for Governor Evers. Governor, does your guidance for businesses to reopen mean that you're starting to see signs that it's time to turn the dial a notch? If so, what will the next thing be to open?
I've used this hypothetical several times, and so I'll use it once more. Hypothetically, there's small business owners, retail business owners that exist all across the state. And small business owners in the retail market are mainly Main Street businesses that deal with small number of customers. That might be a place to dial. It might be. I'm saying that hypothetically just because it's an easy one to describe. But everybody knows that this virus kills, but we also know that when we minimize the number of people that are interacting around customer business relationship, the smaller the number, the better. So obviously, Main Street type retail businesses seem to fit that mode. So it's hypothetical. I'm not saying that's what we're going to do, but it's an example of something being considered.
Thank you, Stephanie. Now to Rich Kirchen from Milwaukee Business Journal. Rich? Milwaukee Business Journal. And a reminder, *6 to unmute your phones. Rich Kirchen? Okay, we'll move on then to Ben Krumholtz from WLUK TV in Green Bay. Ben?
Hi, thank you for taking my call. I know you said you can't give dates for when certain businesses can expect to reopen, but could you kind of describe what the dial looks like, or do you have a model out there that shows the steps that would come next?
Well, one of the steps we released today with those guidelines, they already exist. There's lots of other business groups across the state that have created guidelines. We believe the guidelines that we've provided are important for people to start thinking about it. As much as there are people that believe that we're going to return to the good old days, that's just not going to happen. And so we want business owners, and they have been doing this all along. We're continuing to encourage them to think about what their business is going to look like, how they can minimize or maximize the social distancing in their places of business. And so I'm very hopeful that we can continue to turn the dial, and that these guidelines that people are considering are going to be in place, whether it's getting your supply chain ready, things like that. Business people are good at this. Those that have not been open, there have been thousands that are open now, but those that have not, I know they're waiting and they're preparing, and we have to start where the minimum, where we're going to have small numbers of people interacting at the same time. That's the bottom line. Social distancing is important. It's really difficult to social distance when you have 200 people in a small room. It's easier to social distance when you have 3, 4, 5 in a small room.
Thank you, Ben. Now to Will Cushman from WisconSine. Will?
Good afternoon. My question is for Secretary-designee Palm. I'm interested in contact tracing, and I understand that the state is looking to hire 1,000 contact tracers, and that you're already starting the interview process for those. But I'm curious about how many contact tracers roughly are already working for the state, and whether you expect or think you might reassign some state workers to contact tracing in addition to those people that you'll be hiring.
Mm-hmm. So we have thus far redeployed a good number of state employees to do contact tracing on this sort of surge basis, right? While we are building sort of the more the longer term contact tracing infrastructure in partnership with local public health, a number of the contact tracers that we have deployed to help communities when they are seeing outbreaks or a surge in cases where they need our assistance have been redeployed state employees that we have trained up, who are now again helping local public health departments. The LTE positions that we advertised for and have received over 2,000 applications for, and have started, to your point, interviews for our folks outside of state government who are interested in taking this job and being trained on this job, who have qualifications like good communication skills, being able to have tough conversations, as these are not easy situations where you're talking about a folks' life and safety, and who have good, customer service, good ability to interact with folks who really are going to have lots of questions about what they need to do to stay safe and to keep their families and communities safe. So we were really pleased with the quality of the applications that we've received thus far. Again, the application remains open. I would articulate that we do need more bilingual applicants. We have not seen enough folks who can speak multiple languages to serve folks efficiently who need to be able to interact with somebody in another language. So I would encourage bilingual folks to apply, but we certainly are on our way to meeting our 1,000 contact tracer goal, and are pleased with the progress we're making.
Thank you, Will. Now to WISC TV in Madison. WISC. And a reminder, *6 to unmute your phones. WISC TV. Okay, we'll move on then to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Thanks for taking this call. When businesses reopen under the new guidelines that you released today, are you also expecting schools to reopen at that time too? And if so, are you planning to release similar guidance for them?
We will not be opening up schools before the end of the school year. We continue to work with folks from the Department of Public Instruction and individual school districts to try to plan out a good start of the next school year. That's where our focus is right now.
Thank you, Molly. Now to Dylan Brogan from Isthmus Newspaper. Dylan?
Yes, my question was asked by Justice Rebecca Bradley during the hearing this week. Governor Evers, where in the Wisconsin Constitution did the people of Wisconsin confer authority on a single unelected cabinet member to compel almost 6 million people to stay at home?
This is Brian Nilsestuen. I think, what I'd encourage the Supreme Court to do is look at the state law. I mean, the authority is very clear under Wisconsin Statute 252.02. The people of Wisconsin elected members of the legislature. The members of the legislature enacted that law, giving the secretary broad powers to protect the people of Wisconsin during a pandemic, and that's exactly what we've done here. It's the same thing that every other legislature across this country, every single state has similar laws on the books. We've seen Wisconsin is one of 42 states that use them to pass a safer at home law. And we've seen courts across the country uphold those laws. And so if you're looking at where the people of Wisconsin do, look at the law. In this state, we have 3 branches of government. The legislature is meant to legislate and enact laws, and that's exactly what they did with 252.02. The executive branch, which Secretary Palm is a part of, is charged with executing the law, and that's exactly what was done here in order to protect the people of Wisconsin during a pandemic. And it's the court's role in order to interpret the law. And so I think, this goes back to my comment before. If the legislature doesn't like the law, they need to look at what their function is, and that's to legislate. And they can change the law if they don't like it. Instead, what we've seen here repeatedly is they don't like a law that a previous legislature has been duly enacted, and they run to the court in order to get a different result because they don't like what the law says. And so, again, I just encourage people who, if you dislike what 252.02 says, then you should look at changing the law.
Thank you, Dylan. And our final question this afternoon belongs to Morgan Wolf from NBC 15 in Madison. Morgan?
Hi. So we were talking a lot about getting the economy going and opening businesses back up, and you want them to practice social distancing. But what do people do if they work at a salon or if they work in a chiropractor office where their job is to physically touch people?
Well, that's exactly why we're doing what we're doing as we move the dial, is to make sure that those practices are such that the virus can't be spread. I know in other states they've actually opened up those situations and have immediately decided not to do that. It's not that it'll never happen, but we certainly have to be in a better position statewide to have the virus tamed, and that's why we're doing the testing and the contact tracing and making sure everybody has the equipment they need to go forward.
Thank you, Morgan. And that concludes today's briefing. Please continue to monitor the DHS outbreaks and investigations and COVID-19 web pages for information, data, and guidance. For topics not related to public health, you can visit the websites of the Governor, Wisconsin Emergency Management, the Department of Workforce Development, and Wisconsin Economic Development Corporation. Thank you and good afternoon.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate. WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.